Hey guys, this is Samantha. I did my research project on Progeria and I'm going to tell you a little bit about it now. Okay. Progeria is a rare genetic disorder that causes rapid aging. A lot of times this can be determined during physical exams at a doctor's office. They look for some characteristics. They check a few areas before they make a prognosis. They look at the distinct physical appearance, which is aged-looking skin, baldness, loss of subcutaneous fat, losing teeth, possible dwarfism, and they also look at the presence of secondary disorders, which are atherosclerosis. They look for joint stiffness. They look at cardiovascular problems. They look because of their premature mortality, varying depending on the specific syndrome. And they also look at their intellectual development, which is normal. Now, the main cause of progeria is a sporadic autosomal dominant gene mutation or a random genetic mutation. These also now there are many treatments that can be used to prolong the life expectancy. However, there are no known cures. Daily treatments that a parent can give a child with progeria are low doses of aspirin, and these are to help prevent heart attacks and strokes. They also give them anticoagulant drugs. These are to help thin the blood to prevent blood clots, which also can affect the cardiovascular system and once again lead straight to heart attacks at such a young age. They also get statins, which are cholesterol lowering drugs, to protect them from heart attacks as well. They are also a lot of times prescribed migraine medicine, these to prevent headaches, because if the headaches become too bad, a lot of times they become seizures, which is not good for the body. Now, their life expectancy is not long, although with certain therapies and treatments, children with progeria can live longer lives, but still have complications. Right now, the oldest case living with progeria seemed to be 45 years of age. Now, some of the complications that children with progeria have to deal with are arteriosclerosis, which is the hardening of arteries that leads to decreased ability of blood to flow through the heart. Also, failure to thrive. They look for reduced or delayed physical growth, which sometimes can be confused, which is why they look into dwarfism. Then they have scleroderma, which is a rare autoimmune disease that affects the connective tissue, thus making their skin appear thickened, which causes the wrinkly aged looking skin. Um, Now, by themselves, one can possibly be a lot. However, when combined, all of these together are extremely dangerous for children with progeria. Now, there are some other certain physical and occupational therapies that help with joint stiffness and hip problems, so they need to remain active. Some of other few complications that come into play with progeria are small jaw size. This is where it leads to the permanent teeth erupting before all the baby teeth have come out, so they tend to almost look like jagged teeth, real small, sharp. Orthostatic hypertension is where the child is not hydrated enough, and they begin to have cardiovascular complications. Now, slow growth. Parents are encouraged to offer frequent small meals, encouraging calorie intake. They suggest that I know a lot of times parents are encouraged to put a child on a diet, low calorie. However, because of all of the complications that children with progeria have, doctors encourage calorie intake. So they want them to eat a lot of fatty foods because they lose a lot of cushioning fat. Now, the cushioning fat, we may not see a problem. However, someone with progeria, it's actually very painful. The cushioning fat provides cushion in their feet, on the bottom of their feet, which makes it hard and it hurts for them to walk, as well as around their buttocks, which is why they can't sit for very long. In the home life, basically, a lot of what I found was counseling. First, for the siblings, they encourage siblings to have counseling because they say that a lot of the siblings have guilt arise as they see that they have good health, good physical abilities, more so than their sibling that has progeria. This is where a lot of the counseling has to be dealt with. Also, the not understanding, because even though as adults we can understand when we say what progeria is and how it affects a child, a sibling doesn't really understand this. Younger siblings do not understand, so it's kind of explaining to them is a little pointless. However, an older sibling, if you explain the diagnosis with the child, that way they can look out for this sibling. The jealousy, parents are kind of encouraged to make sure all the siblings have the same special attention, not singling out children with progeria only because between siblings, I'm sure that makes a lot of problems arise. Now, tips for parents, they share through support groups. Counseling is encouraged to help cope with the ongoing needs of chronically ill children. They give them tips on non-contact sports, such as giving them lowered basketball hoops, miniature golf, candlepin bowling, and water play. However, with the water play, it is an excellent source to keep the child with progeria active. They must always keep a life jacket on, even if they know how to swim. They tend to tire easily because of their aging muscles and bones, so the life jacket is always needed in the water in case they get tired. Shopping for clothes, normally we wouldn't think anything more about it, except with children with progeria, parents have to look for certain types of clothing, certain types of fabrics, preferably cotton. They're less irritating to the sensitive skin. They have to find pants with adjustable waistlines and shoes with cushions. Usually are orthopedic shoes, even though they're not as attractive as what the other children are wearing. What's better and more comfortable for them are the orthopedic shoes. In the wintertime, they're suggested they wear thick gloves and socks because they get colder faster since they've lost that body fat. Education. Now, parents do understand, although children with progeria look fragile on the outside, they are intelligently normal. Intellectually, they can progress in age-appropriate schooling, activities, and such. There are a few accommodations that should be made for children with progeria for them to participate comfortably. All individuals interacting with the children with progeria should be trained in CPR and also have access to an AED with pediatric capabilities. If there is oxygen, it needs to be made available in case of the child develops dyspnea, which is shortness of breath. Angina is chest pain, and cyanosis is blue discoloration of lips and skin. Parents need to set up meeting with all the teachers, principal, the school nurse, therapists, guidance counselors, just to make sure everyone understands the plan for any emergency that may arise. Now, the effects of education for a child with progeria. Proper seating. Height difference. They need seating with their where they're able to have their feet touch the floor. Of course, chairs and tables can be lowered. Orthopedic chairs can be offered or cushions supplied. Allowing a child to stand when needed. They become tired easily. They become restless sitting. And to keep their joints from becoming stiff, the teacher should allow them to get up and walk around occasionally. Stools in the bathroom. This way they can reach the sinks. Most of the time, though, in elementary school, there are already stools in the bathrooms. They ask that you prop doors open, such as for the bathroom, because they are too heavy for the child to push open. They suggest 2 sets of books, only because the weight in a book bag may be too heavy for their fragile body. So 1 set for school and 1 set for home. They look into allowing a hat to be worn inside, just because of the balding scalp and their sensitive skin. They want them to be able to wear a hat inside as well as outside. They can make accommodations for standardized and state testing when available, such as being read to, because sometimes their eyesight isn't the greatest. If they are given multiple choice answers versus asking just one specific question for a specific answer. And then also physical education class. They ask that the physical education teacher make sure that they are involved so they don't feel left out. The teacher should monitor any cardiovascular activity closely. Let the child take plenty of rest breaks in between the activities. And because outside time can be kind of warm, possibly tiring to them, they should accommodate it by letting them stay inside or go inside with a buddy. Miscellaneous information. Special education considerations include several items such as possible heart disease or insulin resistant diabetes. These can interfere with the regular school attendance. They may require medical treatment. Now, there are support groups, support networks, therapists, many families that can give ideas on how to help deal with coping with a child that has progeria. Children with progeria need help to cope with their physical changing, as well as other people's reactions to their appearance while they're out in public. A lot of children tend to wear wigs because of the hair loss, and hats. Sometimes they wear sunglasses because of their eyes are sunken in a little bit because of the skin. And then dealing with the concept of their own premature death. No one wants to talk about that, of course. Progeria is rare. Only 1 in 20 million people are affected. It is also caused by a mutated gene. It's not an inherited disease. Only about 250 cases have been recorded since this disease was first identified in the 1800s, and the United States National Institutes of Health reports that the average child with progeria passes away at the age of 13, often from heart attack or stroke. Now, the Progeria Research Foundation provides families with many services. They ask that they get registered in a network that they have online. Once registered, parents can get up-to-date information on progeria. They get a copy of the PRF handbook. They get access to any clinical trials. They get opportunities that become available with research findings. Progeria Research Foundation also provides testing, the clinical trials, research, and conferences that other families with children that have progeria can come together and become friends. They get to meet other people that have the same disease as them. And that way they have someone they can kind of make a connection with, because sometimes, they don't want them to feel alone. PRF serves as a resource for physicians and medical caretakers for families through clinical care recommendations, diagnostic testing programs, and medical research databases, all of which is available online through their website. Now, these are my references, and that is it.